Hello, my name is AJ. I'm your HYPOXiX coach for today, and we have level 3.2 supine release. This is a level 3 mobility exercise and a level 2 released mobility breathography. So now we're going to be adding our 4 stacked inhales with our 8-second slow motion exhale, where we are stacking the inhales, little sniffs of air through the nostrils, 1, 2, 3, 4, filling the ab ribbon, and then a slow 8-second nasal exhalation. Put a finger under your nostrils while we practice this first time to make sure that you're not forcing the exhale. You're letting the air just seep out of the nostrils. So slow, not forced. We're releasing the muscles of our engaged exhale. Release your pelvic floor, release your abs. Use your ab ribbon as tactile feedback that you're staying nice and loose here. Ready? Let's practice. And 3, 2, 1. Inhale, 1, 2, 3, 4. Exhale, 8, 2, and 3, and 4, 5, 6, so soft, and 8. 5 breath cycles on each side. Let's move to our progression for level 3. Now, if you're working with a HYPOXiX coach and they've suggested a variation on the exercise, always follow that. That's based on your assessment to optimize your program. Otherwise, it's a perfect starting place. So we're going to be on the ball of our foot. Instead of our whole foot tripod, we're going to move like we have in previous levels. We're going to move to the ball of our foot, extending, and now using the power of also our ankle extender, our calf, to mobilize the hip joint. Now notice here, I was here before, I can even cross even a little past my sit bone. You know, if you can flatten your low back and press your ribs down in this position, that's key. Okay, and then something that we're adding in today, not only are we squeezing the glute, but we're going to bring our leg up. So the foot is driving into the wall. And now notice when I interlace my fingers, I'm going to bring my knee out to the side of my body. That's what's going to mobilize this hip as I flatten my low back and keep my right rib connected. My right foot is on the wall. And that's it. If you can't grab your leg, you can always use a towel in this position. And if even that feels uncomfortable, then know that level 1 and level 2 are there for you to continue working on the released mobility breathography here. We have 5 breath cycles. Push hard into the wall, and you can bring that leg as close to the ground as feels comfortable, because that's also going to more greatly mobilize the hip. The right glute is gently engaged. Your low back is flattened. Your ribs are pressing down, especially your right rib cage. So I want you to think about that right low back and that right rib cage pressing into the ground. Notice I'm supporting myself a bit with my left elbow driving into the ground. Close your eyes. Let's take our breath cycles in 3, 2, 1. Inhale, 1, 2, 3, 4. Exhale, 8, 2, and 3, 4, 5, 6, 7, and 8. Inhale, 1, 2, 3, 4. Exhale, 8, 2, and 3, 4, 5, 6. Low back down, 7 and 8. Inhale, 1, 2, 3, 4. Exhale, 8, 2, and 3, 4, 5, 6, 7. Push hard into the wall. Inhale, 2, 3, 4. Exhale, 8, 2, and 3. Tight ribbon, and a 5. Relax the abs and relax the pelvic floor. Inhale, 1, 2, 3, 4. Exhale, 8, 2. So soft through the nose. Squeeze the right glute, and a 6, and a 7, and a 8. Whew. Excellent, excellent job. Now it's time to do it on the other side. So you can either rewind the video about 60 seconds so we can perform the exercise together, or you can stop the video now and try it on your own once you're skilled at the exercise. Just stay true to that slow tempo of those slow stacked inhales and that 8-second exhalation, released exhalation. You may want to put a metronome on your phone at 60 beats per minute to have that guidance until it's organic and involuntary, to stay slow with that breathing, as that's going to optimize your mobility results and also the balancing of your nervous system.